In this cartoon, you can see the pancreas gland, which is behind the stomach. It has two main functions. It produces enzymes that digest the food, which come out through this tube, and it also produces insulin. The bile tube originating from the liver traverses through the pancreas before coming out into the small bowel. Over here we can see a part cystic, part solid mass in the pancreas, representing a solid pseudopapillary neoplasm of the pancreas. This is a rare tumor of the pancreas with a low level of malignancy, and the prognosis after appropriate treatment is very good. In less than 1 in 10 patients, it may spread to the liver or to the surrounding lymph nodes, but in the great majority of the patients, there is no tendency to spread beyond the tumor itself. It tends to occur in young women between 20 to 40 years of age. Rarely it can happen in adolescents. Typically, it may not cause any symptoms at all, but it can cause abdominal pain, which can be vague but tends to occur in the upper abdomen, and it may radiate to the left and the right. Sometimes it is asymptomatic and is found on imaging for other reasons. It can attain quite a large size before it is discovered due to its specific characteristics of not causing symptoms and the low level of malignant potential. The diagnosis is usually by way of scans which have fairly typical appearance. Ultrasound may be an initial scan, but really it is the CT scan and MRI scan which clinch the diagnosis. If patient is candidate for treatment, then a biopsy is usually not required. On this CT scan, this is the liver and this is the pancreas, and you can see a large mass that typically represents a solid pseudopapillary tumor with cystic areas as well as solid areas and a well-defined capsule. Ideal treatment of a pseudopapillary tumor is surgical removal. If it is towards the head end of the pancreas, then it's best to perform a Whipple operation, and if it's towards the left of the pancreas, then a subtotal or a distal pancreatectomy is performed. The prognosis is usually excellent, even in the presence of local or distant metastases, which, as I've mentioned previously, are quite rare. This completes this brief overview. If you have any comments, please do share.